So maybe that's why.
I have that problem too sometimes.
Okay,
Yeah.
great.
I see here some notes. Someone's taking notes. Is it Carla, you?
No, it's Giselle.
Oh, Giselle. Okay, great.
I apologize. I have to leave at 3:30, but then maybe I can hear the rest recorded or notes after.
Of course, yes, yes, yes. I hope that Laetitia is able to join. She said earlier that she couldn't join, but let's see. I'll send her a WhatsApp.
Okay.
There she is, good. Hello, Laetitia.
Hi,
Hello.
Laetitia.
So do you want me to share the slides or you want to share the slides yourself?
You can also do it if that would work better. I have a little bit of an old system, so I hope
It's up to you, because I know that I like changing my own slides, but if you want me to do them, I can do them. It's no problem.
Let me start, and if I see there is a problem because my system is old, I've tried to introduce my new Apple, but it requires some technical work on it. So
Okay, well, anyway, I have it open in case we need it, but I know when I'm giving talks, I prefer control over my slides.
okay, no problem.
It's up to you.
It.
Whatever works for you is fine.
So let's first start sharing the screen. Is everybody there?
Not yet. They're just...
Not yet. Okay. Hello, Olga.
Hi, how are you, Laetitia?
I'm fine. I'm fine.
I'm looking very much forward today to the presentation.
Me too.
Yeah, I also thank you for what you wrote about the artificial intelligence and the previous meeting. I thought it was excellent. And but I could also see that a lot of it, what the developments are even removing themselves further away from the needs on the ground where I work. Because it's about in vitro fertilization, about checking really like production more than than anything else. So there's really a concern there that all this artificial intelligence is going to make the gap only bigger, because we will not have input from the field. That's a big concern. Okay.
Yeah, that's a major concern, and a lot of people are working on that, because I'm afraid that society as a whole is not familiar or aware of these concerns. So that's our job to raise them and to make sure that this is heard out there. So I feel that your presentation, even though it doesn't have to do with AI, is very important because it's from the digital world. It tries to do for many years a grassroots initiative to help women who need it the most out there in rural areas. So we are very much looking forward for that. We can start if you're ready.
Give it one more minute, please.
Yeah.
Anyway, Laetitia, I still remember the very first time you came to me saying, "Is there a person at CERN?" It's 15 years ago now, right? Jumbo.
Yes.
I remember
I
that.
hope you still recognize me.
Of course. No, but the first time you said you're going to start thinking about that, I still remember this.
Yes, it started 15 years ago.
Yes.
At an NGO CSW meeting in
I
the
know.
Palais de Passion.
We were together, I remember.
I also had to remember, but how did I get to this? I got to this because I thought it's just ridiculous. It's not possible that I walk into places where in one hut there is a young man with a smartphone listening, and the other hut there's somebody dying because she can't get the help that she needs. That's too silly. That's not possible. Yeah.
So actually now we've had our academic 5 minutes, so shall we start?
Yes, I will. So I have to share my screen.
Please. And while you're sharing, just to say, what a pleasure it is to have Laetitia speaking about where she started and where she is now, the current journey. As I said, the first time I heard about it was 15 years ago when she was just starting to think about that. I remember this.
Yeah.
So thanks a lot for accepting.
Yes, thank you. Thank you for accepting also so that I can do it, because I think it's important. Let me try to get am I sharing my screen or not yet?
Well, you're sharing your screen, but not the slides.
Okay, let me see. Here's the slide. There we go. Yes. Okay. So what's the first one?
So maybe you want to close the other screens and just keep your slides.
Yes.
Great.
So now I will put you on the side, or can I even? Yeah, I make
You-
you smaller. I'm sorry to do that, but just to have the screen.
No, you can just also go full screen if you want.
Okay, is it big enough for you now?
It's
Is
it's
it?
fine.
Yes.
It's okay. I mean, if you want to go full screen, it's just on your left-hand side at the bottom where it says full screen.
Okay, good that you
There.
tell me. Where- because
Right
I-
there. That's it. No, not that one. The thing with
This-
not that one, next one. That's
This
it.
one.
Click.
Okay, good. There we are.
Ah, great. Perfect.
Okay, so what I first have to explain is that I sent in a title, and that title, Eleanor also sent in a title, and we discussed it, and then I made it a little different. Then it went to Manjit, and Manjit changed it into Digital Literacy for Mothers, the missing link in global health advocacy.
Wow. Olga is more likely, but anyway, thank you. Yes.
Yes, and he began, I said, oh, okay. And then I started to work on it, and he said, hey, give me a break. Wait a minute. What do you really mean? I guess you mean that we need to get the data from the bottom to have better global health advocacy that meets the needs of the women on the ground. But then I said, but we must avoid that this becomes again a sort of the bottom serving the top. And I first go for the digital technologies to empower the women at the basis. And when that's working fine, then we can talk about how we're going to share to improve it on the global level. So we have decided to see the problem as something you cannot continue to do a little bit here and a little bit there of help without structuring it. And the structuring for me came from adding digital tools. And the digital tools, it's nice that you remember, it started 15 years ago already. Then everybody thought I was absolutely crazy. It was not possible. But I thought it takes a long time. And in the meantime, it ripens. You get more and more people picking it up, munching it over in their own way. So it's going to make its way. And it does. It definitely does. So for me, it was really the Jambo Mama is, and why did I call it SAHFA, Smart Access to Health for All through customized new digital technologies. And I wanted to start with the most vulnerable, which is the mothers and the girls of childbearing age. And their liberation or their increased happiness comes first of all from being respected when they are pregnant and to have proper care so that they can bring life into the world without immense suffering, without lasting disabilities for themselves, losing their child, or even dying. And now that is something which is just really needed. We may need a further development into a much different concept or position of childbearing in the society, but that's their own development that they have to do. I do think that bringing digital literacy will help to make it all, make the composition of the values and important things in your life different, but they will do that themselves. So I'm going to do this expose on the need for direct digital empowerment of the mothers. And with that, we can discuss what the needs are for the cross-cutting contact up to the global level to ensure that we defend the real needs and rights of those sisters of us, and not that we think that what we think they need, but what they want themselves. Okay. Mm-hmm. So what does it look like at level 0? Can you see the picture? How it is to capture the waves at Itambang? They hang their smartphones in a phone to try to capture a little more internet. So we start in our project with the most vulnerable and the most forgotten, which are the girls and the women of childbearing age in rural areas. They have low education, low income, low levels of overall modernity, and one of the results is that they have hide and seek connectivity. They really find the places where they can get a little bit of capture, a little bit of internet.
Laetitia, can everybody mute, please, except for Laetitia? Please, thank you.
So I have good news for you about this. I really loved to see how inventive they were to find internet. But we have been working since I went there. I spoke with the highest level orange responsible there. And I spoke with the local ones, and I tried to negotiate and said, you have to bring an antenna. The women have to need this. So finally, this antenna has been built, and I could say everything is ready to move in for it. But in the meantime, I do not have the capacity to take care of all that, neither financially nor in terms of manpower. So I have a lot of people who are extremely willing to do it and who are competent, but they need more support around them. Even in a place as messy as Congo, I tell you, there are pearls, they're just pearls. But if you put a pearl in the mud, it cannot shine. But if you put it on a velvet thing, it can shine. And that's what we really have to try to do. So this place has now, thanks to SAHFA efforts, it has now internet connection. So now it's got to be used. So if you look at what the real problems are, there is a low level of literacy. There's a low level of virtually everything. There's alphabetic and digital literacy is low. The intermittent connectivity is another problem, and the women and girls have an inferior status. So are we crazy to insist that it can be done? Well, I hope I'm not crazy, but I'm just doggedly determined to break through the barriers, well, whether they're technical or social, cultural, political or economical. They've got to be broken down, no matter what. In the 21st century, you can't have equality. You can't have a society in which there is room for happiness and health for all without digital literacy for all. And that digital literacy should be with digital tools that are used to promote empowerment, not enslavement to consumption, because that's what we see, and a big concern with our own youth, that they get enslaved to consumption. I've seen it with my own grandkids. It's a big struggle of the parents. It almost, it exhausts the parents to try to stop it. Neither should our digital tools impose a change of the most intimate worldview to access modernity for security. In this case, it is lower maternal mortality and morbidity. That is really what we go for. So the digital literacy for mothers then, how can it reduce maternal mortality and morbidity? If we all know that the biggest statistical gain comes from less pregnancies per woman. But for the woman herself, it comes from safety per pregnancy. The average number of pregnancies per woman will decrease as pregnancy and childbirth safety increase. Why? Because each pregnancy will require more active management by the mother herself. It's more of an investment. It's not a lucky or unlucky dip. And better external working opportunities for all women and well-informed access to contraception will be the main drivers of the reduction of pregnancies per woman. I am convinced of that, and it will not always work. You can find places where they say, hey, we improved, and then suddenly they even got 6 kids instead of only 4 because there were the 4 surviving. But that's the transition. Normally, it doesn't work that way, and there is more responsibility per pregnancy. But look at what it looks like in reality. It's so terrible. I mean, you cannot, inside a maternity ward that I visited in Kwilu, it's so sad, it's so drab, it's so dirty. None of these moms is happy here. You can see that. They have no dreams of wellness. They have just dreams of survival. Sadness and somberness prevail, as you can see. One of these babies, the one with the mother in front, died soon after birth. I shall never forget. We tried to get antibiotics for him. It was just too late. Horrible, horrible, horrible. Yeah. So what are the main challenges women and girls faced? They are listed live when I listen and observe, and they're also mentioned in literature. It is how to pay for goods and services, the transport, attend to national, well, you all know this, the nutritional complements and vaccines, credit for mobile communication, collect the necessities of the maternity kit, pay for the delivery fee. They're all ridiculously low amounts for us in a highly developed society, but even these low-level amounts are a lot, and they are not liberated for the women easily by the men who control the purse, because they feel that you can just, his mother has got babies, anybody has, so why should you bother at all? So the second is, if you in the first case, you already are aware that there are goods and services that you need, but you need the money for them. But the second point, which is widespread even among higher educated, is that there is a limited understanding of the crucial moments, of the needs or danger signs. So the decisional triggers that we feel to ask for help are not there. They are kept back because of her lower position, by the lack of money, by not wanting to disturb, and by having no specific knowledge. Now I've got to get this type of help. In the third then is that no one in the health sector is informed that she's pregnant. So there is no monitoring and there is no timely intervention when something happens. Solutions like maternity waiting homes were all the craze in 2000, but I discovered that they're really dramatic in their impact on the women's opportunity cost at home. If she has to go and she doesn't know exactly when this baby is due, she may spend a couple of weeks. But if she spends a couple of weeks away from the home, her harvest is not brought in, the children are left with an aunt who is not really that attentive to them, her little business will suffer from it, and worst of all, her husband will bring in a new, younger wife. So she comes home, she'll have to share the space with a younger wife. That's a lot to pay for a safer birth, because the safety of the child also depends on the bonding and the possibilities after the birth. So the factor that is aggravating all these listed problems is her inferior status, her low education level, and poverty. And the three, of course, are intertwined. But many also fail to get the right care when they need it, because they don't really know what is the right time for what. The famous decisional delays lead to unnecessary maternal mortality and morbidity. These should be reduced for all, regardless of educational level and income. And now my point was, and it was so nice that you remembered, Manjit, we cannot do it without smartphone applications that incorporate all these challenges and teach the women and lower level care providers in the rural health sector digital communication for the maternal health management. Otherwise, we cannot get sustainable, lasting solutions to remove these intertwined hurdles. We really need that kind. Otherwise, you have a solution today and tomorrow it's forgotten. It has to be organized, structured through a proper app, through proper information organization. So here is our little video that explains both to the mothers and to potential donors how it works. I think we shouldn't play it now, but I invite you to look at the link and listen to it yourself. You can also find it on YouTube. It's very nice. You see clearly what it is about. So I leave it for the time. So we now come to the part of the matter, which is the demand is really great and varied. I told you, I receive WhatsApp messages, makes you cry so strong is the, Laetitia, when is it coming back? When are you going to give it to us? Also, nursing schools and midwifery schools who had started with me to work on using it and practicing their field and assignment using this Jammo Mama app, and they loved it. So it's really stupid that there is a big difficulty to get it going again, but I will briefly explain to you why. So the missing link to make it work, in my opinion, is that we need big funders who don't mess with the design and with the delicate dialogue and allow it to be built from the users up. And that is really working. What you cannot see here is what's going on the field. I just received another little mail today saying, Laetitia, we know that you don't have the money to do this right now, but it's beautiful how we have been working. The mothers themselves, an engineer who's building metallic doors for safety, the patron nurse of the center, the head of the diocesan bureau of medical of the health sector, a former what is it, a World Food Program director who is helping me and who is also getting in touch with them. It's just unbelievable the kind of partnerships, informal partnerships that we develop, and a real international discussion, again thanks to WhatsApp, I must say. So there also you see the digital support to get some ideas, working them out, test them directly, adjust them to what you find. And we do get them now to ask the mothers themselves, what do you want? For instance, in Lumu, where I got this information back from, they said, we do not want another safer metallic door, but we want a kind of wiring that people cannot get through so that we can sit outside, take fresh air with our babies, and we cannot be attacked. We're talking here about East Congo, where just barely a month ago, another maternity was attacked. The women just, slaughtered while they were feeding their babies. Absolutely horrible. So we were discussing with this health center where they do the Jambo Mama app sessions, how can we make sure that they are safe? And a certain solution came out that was really a local engineer, a local metallic carpenter, plus the women, plus the staff. It's amazing what you can do, and it's a fast and effective kind of discussion. And I have it in Kenya about the teenage moms. I have it about, it's just amazing. So these big funders, we need them, but they should let this, they should let the dialogue work on the ground to make sure that we do not take over and again start to impose from sort of metadata analysis when we are working here in the reality that affects these mothers. So the main purpose remains to link the mothers, the medics, and the mediators, but the mother is going to be the main agent. And I tell you, I have to get back to that all the time, because even if we do a demo of the app, the man who shows it will just quickly go through, choose your picture. I say, no. Choosing your picture is part of the woman learning to make a choice, to try to listen to herself. And so here also with the needs for this Luma Health Center, I had to insist, talk with the women. What do they want? What do they need? But you can do that when you go digital. And now I ask you, how can bringing digital literacy to rural mothers be supported by global health advocacy to get the big funders? So I've turned your question around, Manjit, just so that you also look at that. But I am aware that we want to look at something else, which we will come to almost immediately. Here I wanted to ask you, look at these two screens. Do you see the difference between Jambo Mama for moms on the left side and Jambo Mama for moms on the right side? And can you imagine what the difference is, what it is caused by? Do you see the screens? Hello?
Yes, we see the screens, yes.
Can you see a difference between the screen on the left side and on the right side?
It's the thing at the top of the age of, sorry.
Yeah, it shows the gestational age and the expected date of delivery, the EDD.
Yes,
Exactly.
yes. And that's on the right side. And this is when the mothers have accepted to register. If they register, they will see that it's like magic for them. They tell when they had their the first day of their last period, and then the app tells them, okay, your baby is going to be expected, it's due that and that date. If they are hesitant, they can still look at all the information, but they will not have it tied to their own situation. And it's a very powerful trigger for them to be interested and to come back, because they find it magic to have more understanding of why when this baby is due. They do not really have a good understanding of it. So that's exactly the difference. This is when you do not register. The right hand is when you have registered, you've answered a few questions about who you are, when was your last period. And based on that, she can follow her pregnancy, and the health provider can give her advice. Her schedule of antenatal consultations can be worked out, etc. So now, if we look at the digital literacy for mothers in the sense of the way you wanted to look at it, how the digital literacy of mothers can strengthen the global health advocacy by providing high quality, usable and verifiable information and experiences from the bottom to the top. So then we have the big challenge. It should not be exploitative. It should not be another type of colonization. The rural and low-income urban communities are claiming compensation now for all they did for researchers and human rights militants without seeing returns for their own people. I was amazed. I wasn't aware, but really some had strong arguments now, and I understand them. So here we go back to see why we try to focus on the mother herself. So if you look at it, if you looked at the screen, the play of cards, the game of cards with the follow your pregnancy on the right, that's your general information. Periodic questionnaire is how it applies to your own feelings. On the bottom is your vital info checkup, and on the right is an emergency has occurred. So, and as you saw in the previous picture of a registered and a non-registered user, then the app knows how many weeks you're pregnant, and this section opens to the screen for the number of weeks of your pregnancy, and you can scroll backwards and forwards. If you're not registered, you can go through it as a video slideshow. This card or module contains two submodules, one showing the mother's changes, left, and one showing the unborn child changes. And that they're also fascinated. They've never seen what the baby looks like in the womb. And the health facilities using it say it's very convenient for us that you have separated those two. They can show to the mother, they cannot always do an echo, an ultrasound, but instead of the ultrasound, they can show the pictures from our module. So that's also something I hadn't expected to be so useful. So if we continue, if we look at the global health advocacy, that I need to find funders that really give us the possibility, because I do not have the clout, since I do not pay enough, to make them give priority to the work for the Jamo Mama app. But if we also want it to help us get good, immediate information, we have to avoid that it becomes data pumping. Because if it doesn't have a direct positive impact on their own health and basic necessities, it's really not fair. And that's why I said there are complaints now that they have been lured into a lot of work. And I've seen it with my own eyes when I'm in Tanzania and it was the rainy season. And at night you have to go home. It's not safe to be in the dark after 6. And the poor midwife was sitting there because she still had to type away at all the information that she had to send electronically to the Ministry of Health. But you see, it's sent to the Ministry of Health. We discovered when I did my rounds in one of those hospitals that there was a local malaria crisis. They sent that information, those data on, and they do not get support. There is no call from the ministry to say, we saw that you have a malaria crisis. We are putting together for you a kit, an emergency kit, and you will get support from our malaria experts from the district. Nothing of that is happening. They just sit there and work. They get home late. They cannot even feed their own children because they come back in the dark when the children are already to sleep. And all this to feed data up instead of getting the possibility to look at those data quietly, maybe even in the safety of their home with their kids, and say, oh yes, this mom is at this, oh, that woman is here. And that's the kind of digitalization and dashboard function that I want to work fine, so that they have the luxury of being able to say, oh, in village A, I have a lot of people come with fever. What's happening there? And you may find that there was a party and that they've all eaten something that was really bad and a high risk for the women, depending on the number of weeks they're pregnant. But they do not have access to this kind of information because the digitalization that there is goes up to the higher levels and is not available to them for their own work, to compare better. So that's why I say digitalization must first serve the communities themselves. The caregivers must be able to see what's happening. The women must be able to understand in kilometers that people don't live far from each other, but it's still a walk, a ride. It takes time and money and effort that are still all in scarce supply. So, and for us, even we also send apps to people who live in the same village. We don't always grab the bike to ask personally. We use it and it saves us a lot of time and trouble. Okay, so now this is unfortunately also affecting the rebuilding of the app. So then we have finished. So why does it affect also the development of the app itself? Because we are also subjected to pecking order, to profit, and incomprehension about the real challenges. That's just so difficult. IT is a business that wants to go for the fastest, the latest, the raciest. But Jumbo Mama is the opposite, and yet it is technically very sophisticated. But it's not an attractive challenge for these guys to build an app and maintain it so that you can use it on lower level Android versions, editions, you see, because that's the apps, that's the telephones that are circulating in the rural areas. So it's got to function well on lower level editions of the different smartphone operation systems. And that is something that they really are not trained to do. And you ask them to say, of course we will do it. But then I start working with them and they don't. So, and also the next problem is when there is a software handover, the new team can't pick up where the app was, though it functioned with just bugs to repair. Because at each handover, it stops, regardless of our precautions. I cannot tell you how big a challenge that is that really prevents me from sleeping. We spent literally years and thousands of euros, and it's not donor money, it's my own savings, to find good partners. But the kind of involvement that we need means that this project should be for a while the only one that the engineering team works on. But that is so pricey that we have not been in that position. So they take it on, but they take it on at a good price, which also means that you're mostly on the back burner when a bigger, client comes in. And then they lose the knack for what they're doing because it's not an easy thing to switch to that mindset. And the huge gap between men and women, between urban and rural, rich and poor, north and south, they all play out in this business challenge as well. But I'm not going to give up. I can tell you, I won't. It's going to work. It's going to work. And we have it. Here I show you, because it is a big challenge to get it ready to be put on Google Play and Apple Store. Therefore, we also create with the content of the app separate modules, PowerPoints that can be used for group sessions. For instance, about this is the opening slide of one that has been produced by our team in East Congo, why you should consume vegetables and fruits during pregnancy. And the women love it. They find really that they learn a lot. And, Mr. Emile Baguma made this. It was not very usable, but we go through this process together. I show how you have to present it, how they can read it. He likes to be very wordy. I like it. I say, yeah, that's good. You keep that in the way you explain it. Now, this is what we put on the screen. And so we are also training and using digital support in a way that it works with the contact and the dialogue with the end users, the women themselves. So, okay, I think that's just what I wanted to show, and I think we are ready for the discussion. So I leave it to Manjit now. Thank you for listening.
Thank you, Laetitia. Great and wonderful to see the progress and where you started 15 years ago. So I open this for our colleagues online for the questions, and then I will ask anybody has any comments, questions? If you want to stop sharing, you can. It's up to you.
Yeah, I'm stop. Yes, here we are.
So we can see you, you see. There you are.
Okay.
So this is really great. I mean, it's amazing what's happened. I know it's challenging. It's just the way it is, you know, when.
But the communication, the fact, you know, as an anthropologist, we were always taught participant observation, participant discussion, and whatever consultancy accepted, we were supposed to do it. You sit in a group, the women cannot say anything. There's one man, he speaks, others say yes, yes, yes. But now with this new tool, they feel that they can hide, as it were. So they write to me, Laetitia, and I receive these little messages. They okay, and then I bring it up with the doctor, or I put it somewhere else, and you can put the strings together. It's really marvelous. Yeah,
that's great, excellent. By the way, just as an example, you know, we say women don't speak and the men are speaking. This is, you're talking about grassroots, what you're doing, but I assure you it's the same in a lot of academic discussions, the meetings I'm at, just so that you know.
Yeah.
Anyway, sorry, Eleanor has a hand up. Eleanor, please.
Well, first of all, to say a huge thanks to Laetitia for, you know, just sharing the sorts of lived realities that those of us in the Global South go through. And I smiled when you showed the picture of the phones, and then, you know, it saddened me when you showed the picture of the women in the hospital, and you were saying horrible, terrible.
Yeah.
And, you know, for some of, you know, the rural areas that we work in, that really is an upmarket because you have beds. The reality is in a lot of the rural areas, the women are still on mats on the floor. So these women were all sitting on beds, which, you know, whilst you were pronouncing horrible and terrible, as I say, that's an upgrade. So, you know, if I can pick out what your clarion call is, to say, you know, for those of us who are privileged to be on this call, is to, you know, spread the word about the lack of equity. So sometimes, you know, when we're speaking at international fora, we're in Geneva, where, you know, these realities do not come to the fore as to what our sisters are going through. So how can we, you know, spread the message? One can blame governments, blame corruption. I'm right now in Nigeria where, you know, our government leaders at the slight, you know, cough or cold will, you know, fly to France or to the UK. We know, for example, that the past president of Nigeria, it was, you know, normal for them to put in the headline when he died, the immediate past president, oh, President Buhari dies in a London clinic. And yet they are not using the resources that they have for, you know, the women, for healthcare on ground. So what can we do? It's to, you know, provide the stopgap measures, those of us in civil society. So the next call, apart from spreading the word that I heard from you, was how can we raise alternate, you know, funds? And again, you know, it's about showing credibility through our NGOs and accountability. some of the things that, I didn't hear, and that's, why I said I would like to have a session on, cultural practice, is you spoke of delays.
Yes.
The women you are talking to are privileged because one, they have smartphones, and two, they have been allowed. What do I mean allowed? You feel, yeah, of course, any woman can have a smartphone. No, but we're talking of families where the woman needs to seek permission to handle a phone, seek permission from her husband or her mother-in-law to even get to a healthcare facility. So even if she's bleeding, she's waiting for her husband before she goes to seek help. So those are some of the cultural impediments. Thank you for, installing an antenna so that they don't have to hang their phones on the tree. Sometimes in the rural areas, some of the areas I work, the women have to go, climb up to a height, to the mountain. So we set a time at a particular time of the day when we can interface with them, or they're able to download when they go up to a small hill. They download and then they can look at things on the app offline. Lastly, wanting to say, as we hold these meetings now, I would like us to really have, concrete call to action, because we establish what the issues are and we applaud. And quite frankly, after being 30 years running an NGO myself, I get a bit, exhausted at the talk shops and the lack of action. So how can we as a task force or task team task ourselves with practical solutions so that we can have some form of indicator to show that our task team has really touched lives on the ground? Thank you, and over.
No, Manjit.
No, I was just going to thank Eleanor for, you said 1, 2, 3, and 4. I'm going to add the fourth point, and that is from talk to reality and action. There is a long river to cross and a big mountain to climb. And I think that, like you, I came to Geneva in 99, and we keep talking, but it's very hard to turn into reality and action. And this is why seeing what Laetitia has been able to do shows you that things are possible, but it's not an overnight miracle. And the challenges keep being there. So Laetitia, please, go ahead.
Yes, I think it's good what you said. I mean, what can you do? You can do a lot with your own contacts. If you have contacts in the health sector and you would, for instance, read, or you would be interested in the approach that we have, I could come through you. You could share what I could put you on the list. When I also read new information about healthcare for maternal care that seems to be suitable and respectful of the way the situation is in a local area, in a rural area. So I read that, I make a sort of snippet for it, and I send it to my contacts who are in remote health facilities. And they are grateful because when it rains a lot, sometimes the women cannot come. If you send it at the time that it rains, they cannot download. But if they have quiet moments, they can download what I send them, and they can look at it when they have a quiet moment, because they are in every little health facility. You find at least one person who is intellectually more alert to growth, and that person will pick it up, and that person will sort of spread it with the others. Some are just practical, but everywhere I find one that is just so keen on knowing more of everything. So those I discover, And I share with them, I ask, and they say, oh, that's very interesting. That's really helpful for me. And it stimulates them to stay at a certain level and not fall asleep in that little dispensary where they are. And you could do that too. You could just help sharing this kind of information. At one point, I met someone who was the dentist, or he had to do dentistry. He had no idea, but I still happen to have on my computer the full "Where There Is No Dentist," which I translated into French and did pictures for it in Senegal. So I still have it. I gave it to somebody in Mugana. He said, oh, that's great. Now I can do what I'm supposed to do. So there is a lot of work. There's the Hesperian Foundation in America, who has a lot of great materials that you are free to share. So, and it's not too much at a time, but the things that are downloadable that they can easily find back. So I'm always very careful that it shows where it comes from and how we send it, just to make sure that the snippet is already giving an important message. And if you want to back up the snippet because you talk about it with your supervisor, somebody else, you can find the proper source to extrapolate on it. So that's one thing. And then also we think that after a while, the app should not be too heavy. As you say, you've got to be able to use it offline. That's one point. And the second point is, if we overload, we get a situation like the young women now, that they have so much information that they're constantly worrying about their pregnancy. Whereas I'm sure most of you were pregnant half the time. We didn't really think about it. You just go on with your business. And when you can think about it, and it's nice, but it's not the whole time. So there has to be a balance. We have to avoid that we push the women who now live in total ignorance, which is sometimes blissful and sometimes sorrowful. But if we bring more information, that it makes the point. It's not, making that seed of anxiety and self-importance, because that's not going to improve the quality of the pregnancy or the outcome of it. So that's also a thing that we can do. And then we can have like a web background. If you want to know more, click here, and then you can get more information about whatever, vegetables or this or that or the other. Whereas in the app itself, it's the main point. I wanted to come back to the smartphone. The smartphones are not yet in the hands of the women, though some of them have them. You have seen in Kenya and also in Tanzania, certain places, there's young women who have them and use them for their antenatal checkups, to go and see the doctor. They have created already a much more egalitarian relationship with the healthcare provider. That's another important thing. Instead of being an object of care, she has to be the subject, the agent of that care. And that's what we have to give back. So I also hope that this app can help us avoid over-medicalization. And when I said we need big funders, I really mean not that they try to take this from us and make it into something and then it comes back, because it's for the Ministry of Health. No, it's got to first work at the local level. Yeah.
Thank you, Laetitia. Valerie, please, you've been very patient with your hand.
Sorry.
No,
no problem. First of all, thank you, Laetitia, for the presentation, and congratulations. I really admire how determined you are to move forward with Jumbo Mama. I mean, it's been already quite a number of years, if I remember correctly. So, wow.
15, Valerie, 15.
It's really a pity that you can't find any, big funder, as you say, to properly develop it. I was just wondering, technically, it doesn't seem so complicated. I mean, in another life, I have been a software engineer myself, but I mean, is it connected to some other system or is it standalone?
It's standalone, but it's supposed to be connectable. It's not like reinventing the wheel. So what we wanted to do is, for instance, if you talk about the screens for after the birth, it also says, now make sure that you do not get pregnant again, because you need time to feed this baby, to recover, etc. So we have the soft approach to this, not like a very militant approach, because it doesn't appeal to the lifestyle. And then I do not want to get our own separate service. I just want there to be a telephone number and a service, but that what we do when it's in the app, I want it to be checked. When you go there and you say, oh, I'm breastfeeding my child, how are you going to be received? What I really want is that it's also quality check, not at the top level, but right there. If you have a taxi driver and he was allowed to have his taxi transport business in the app, then there are requirements. He cannot yell at the woman if she loses the water while she's in the taxi, but we will also help them have a sort of a budget, or ma'am, I'm ready to give us a subsidy for that, so that for a relatively small amount, they can be sure they have a safe disinfectant for the car, that they have something to cover the back bench, so that we do not rely on buying expensive ambulances everywhere, but that we can have, a sort of intermediate solution where you can still have a taxi, but the taxi driver will be very angry. Also, if something happens in the taxi, they will say, nobody wants to take this taxi anymore because a woman here lost her waters, or there was something. So it's easy to be critical of what people do not want to do. But what I do then is to understand, I understand that there is a problem there. How can we help them with that problem? So if we want them to have a motorbike that's clean, it's not dangerous for a woman to go to the hospital or the clinic on a motorbike if it's the first start of the contractions, not when she has waited until, but the first. If I ask the doctors point blank, they will say, not really. There is, of course, a risk, but we are not going for zero risk. We are going from massive risk to a risk that's still reasonable, and an enormous reduction compared to what it was. So if you can have information in the app that says, oh, did you lose water and you better get to the hospital now. And then, since we also have a module where we ask, how far are you from the place where you're going to give birth? How long does that take? Did you put money aside for it? Do you know who's going to drive you there? So that all these things have been talked about. And then when she comes for 20 weeks, she can discuss it with her health provider, and they can look in the app together. She can say, oh, no, it's not possible because you have high blood pressure. You cannot give birth there. You have to go to this place. Then you can adjust it. And then you can avoid a lot of what all the health facilities hate, which is baby born away from the hospital, BBA. And meaning they're not going to get the prime for safe birth. They're not going. So there's also a financial incentive for them to make sure that the women come on time. And coming on time cannot be everybody asking for an ambulance. It should be because they know better when to go. Many of them can still use a motorbike, but then we want to be sure that it's clean, it's safe. So we check. There may be special small adjustments that you can put there, or you can have a side span. Well, you see, so each time I want it to be locally working, and I base myself on observation. I once was driving to, I don't know, somewhere in Tanzania, or was it in Congo, and I see a whole village with a woman in a stretcher, and the pots and the pans and the mattresses, everything was there, because it was a long trip walking. And I thought, it's brilliant that they do this. But if we have an app, they can have a sort of a duty, this week you're on duty. John and Jim are on duty. They are the ones that carry, and they have a little bit of something available. It's a small thing, and you can do it if you have an app that even works at that level to improve the coming to the place from where she can be transported with whatever vehicle. And I think I also worked on an island in the Victoria, in the Lake Victoria. And then they wanted to have a marine ambulance. I said, a marine ambulance for the 10 families is a little bit much. But what you can do is organize a Jamu Mama boat, And it means, because you're not all going fishing at the same time, you can always have one boat lying there, and you make sure there is a can of petrol for the carburant. There is, you have the basics. There is a comfortable thing. You have a smartphone app that you can't contact the hospital. We are coming. We have this woman. So all this is possible. And I say, once you have done that, you've shown it, then a politician comes and they see that you are, up to the teeth, willing to do something, then they say, oh, I'll give you a marine ambulance. But you first have to show that you are, up to it. And that's where the big disasters happen, that we do not whip up. And I've seen now with my WhatsApp, you can do it. There was a hospital, a little dispensary, was terrible state. And the women had to lie on a slab of cement, concrete with, and then they asked me, can you buy a mattress for us? I say, I cannot buy a mattress, but you can find out, do they not officially have a right to have a mattress? And then I mobilized, and they got the right authority and got the mattress there. So there's still a lot that can be done, which you can do if you have digital support to give this a little more power.
So Laetitia, I think these discussions, we need a lot more time for that. And I can see from your passion and commitment why your activity is working. I'm really going to be sorry to have to interrupt, just since Dianova and Giselle was willing to delay their seminar by 1 hour so we could listen to you without being, be contradicting. I just want to make sure that people who want to join that in a few minutes, that they have the opportunity. But I think we need to bring you back to have some more discussions. And I hate to interrupt this very passionate discussion, because actually, Valerie, just like listening to the stories and your webinar, is that commitment and passion and seeing the vision and following it through that makes it work. And it's really amazing. And congratulations, Laetitia. I could never have believed that it could go this far. And so, as I said, I didn't mean to interrupt you, but I see that it's almost 4 o'clock, and I want to make sure that we can join also it's technology and cybersecurity, I think, the seminar.
Yes.
So it would be really good to give her support as well, since she gave us her support by delaying her speakers by 1 hour. So I'm really sorry to have to say we should perhaps stop, but we should have some follow-up discussions. Really appreciate your passion and telling us and what you're doing. And thank you to all of you for your, being here and active participation, and Eleanor for suggesting that we should do this. Remember, for the 16 days of, activism, you said that we needed to do that. So it was a great...
And remember, SAHFA is a movement, and the movement is that you acquire the idea, you spread it in your own way.
Sure.
You can get back to the source. That's how we build up the source as well, and make it into a movement. And young people are really, they like it, because they are so attached to their telephones. They can understand how terrible it is if you don't have it, or if you can't use it. Oh, well, I saw that Anne wanted to talk as well.
In case we don't have the opportunity to just wish one another compliments of the festive season.
Yeah.
Thank you so much. Yes. We look forward to seeing you after the holidays, because that will be the next webinar we have to arrange. Thank you so much, everybody. I'm sorry. I think we should let people who want to join the other webinar do. Thanks again. Thank you very much.
Bye-bye.
And Olga, you will have the recording, which you'll be able to share, right?
Yes. Hopefully.
Great. Thanks a lot, Olga. Get well. Thank you again.
Thank you.
Bye-bye.